Welcome to Rural Health Answers, a segment of our podcast, Rural Health Today, for you, our listeners, to ask questions only rural health experts can answer. John, welcome back to Rural Health Today, and this is our segment for Rural Health Answers. The question from our listener today is, what challenges do you see in developing and maintaining telehealth capabilities in rural settings?
Well, there's a couple things that we need to do, and you're well aware of this, and that is we need to make sure that it gets paid for. That's number one, and that happened during COVID, and we need to continue having all telehealth reimbursed, and it doesn't have to be. It can be audio too.
Right.
I think it should be audio. It should
not
be
just tele because of the communication challenges.
There's challenges.
So what is the legislation right now? It goes away. Technically January 1, or when does it go away?
I believe
the reimbursement.
I believe it's the end of this month.
It's this month.
Yeah.
So the only way really to save that is to have some type of congressional involvement.
I hope I'm not misspeaking, but I think it is.
No,
this
I think
month.
you're right. Yeah.
So that's number one. It's key. It's community engagement again. You got to let your elected officials know that, you could be in Horton and and why have to drive here? Why not use a teledoc? Get on the scale, get your weight, your blood pressure, have that come in.
Yeah.
It's all, remote patient monitoring, that should be all paid for. Those are things that are easy to do every morning. I use teledoc.
I do too.
And it's helping.
Yeah, my provider here in our system does virtual.
Yep.
And with my schedule, you know how easy it is for me to get a virtual appointment? Much easier than going in to the actual, because we work during the day. I mean, there's a lot going on. So she'll say, all right, before or after, we'll set up an appointment at 6:30. And I do a 6:30 televisit.
Beautiful.
And it works great.
Yep.
But, we have all these challenges, though, is in reimbursement. Hospitals can't do things for free. And so that has to follow.
It's more advocacy. It's never ending, right?
Absolutely. And at every level. The listener today doesn't have to be an executive. It's the consumer. Patients need to lift their voices, because if they lift their voices to their congressional leaders, it's going to make some differences.
When they come into town, visit them.
Absolutely.
And they all have people who are working in district. Visit them. Let them know.
So you heard it right there from John Barnas talking about how we can sustain rural healthcare in telemedicine, and that is make sure that the funding follows it. If that's in place, then hospitals can continue to offer those services. And in rural communities like Hillsdale, a community with no public transportation, rural healthcare telemedicine is vital because patients can't physically drive to their community. So if you're listening today, reach out to your congressional leader and tell them that you feel that this is very, very important. And again, thanks for joining us on Rural Health Today. Thank you to our listeners for tuning in to Rural Health Today. Catch our next segment, Rural Health News, to stay up to date on the current state of rural health every Monday, wherever you get your podcast. Don't forget to check out our latest updates and resources from Rural Health Today at ruralhealthtoday.com. And make sure you've subscribed to the show so you never miss an episode. Until next time, remember the power of rural.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to our guests for sharing their expertise on the show, and also to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.